Welcome, Angela, and everyone attending this year's conference. I'm very honored to be part of the presentation for Angela Kimball receiving the 2022 Oregon Advocate of the Year. My name is Bill Bushka, and I've known Angela and worked with her in different capacity since I think the late 1990s. And I had the opportunity to get to know Angela when she was a mother who was concerned about the services that her son was receiving at a children's mental health program. And luckily, I had a strong family involvement mentor. So I was well informed enough to listen and partner with Angela and listen to her concerns about the program. And they were really good concerns, and she was concerned not only about the care her son was receiving and her involvement in the services, but she was also concerned about the program overall, and was really conscious about, I want this program to be better for kids and families that come after. And it was a really unique situation. Ordinarily, as someone who worked for the state and a state regulator, when there's a problem, you do a corrective action and you require all kinds of things of the program. Well, what we decided to require at that time was not only did they have to meet with me and give me documents, but Angela was part of those meetings too. So that was pretty good punishment for the program. They not only had to meet with the state regulator, Angela was in the room also, and that really kept them going on a very good path. So as I got to know Angela and through that work, really quickly pulled her into state level work because of her ability to see problems and see solutions in different ways. And when Jason asked me to be part of this presentation, the words that immediately came to my mind about Angela were persistence and determination. But she does it with compassion and grace, which are really amazing qualities for an advocate and for someone who does the work that Angela has dedicated her life to. When I asked other people that I've known and that I know have known Angela for a very long time, one person used a quote from Bayard Rustin, and that quote, and he was a key advisor to Martin Luther King. He used the quote, and I think this fits Angela very well: angelic troublemaker. And other words that I got from people was that she's extremely effective at getting things done. She's well-spoken, ethical, and an important advocate for those who have yet to find their voice. And I further took advantage of Angela's skill and bringing her into some key initiatives that we did at the state that really fundamentally changed the role of family and youth in the children's mental health system at that time. And she co-chaired the first Children's System Advisory Council that we had with a really traditional mental health provider, and did a great job co-chairing that. I think that was the first time that we had a family provider co-chair of a state meeting. And through that work, she fundamentally cemented youth and family involvement in Oregon. I then had further opportunity to work with her when she worked for the state as innovator agent, as we were rolling out the coordinated care model and the CCO model throughout the state. And I was honored to work with her in that capacity for a very long time. So knowing Angela since the late 90s, I'm proud to call her a friend, a mentor, and a colleague. And she is well deserving of this award, and it's long overdue. Thank you very much for letting me be part of this presentation, and congratulations, Angela.
Hi, I'm Bob Jundeff, former director of Disability Rights Oregon and a longtime advocate for safe and respectful mental health supports and services. Imagine a world in which the Oregon legislature decided to stop coverage for behavioral health treatment under the Oregon Health Plan, where Oregon insurance companies were free to discriminate against behavioral health services in terms of payment rates for services and total amount of coverage. and where some insurers could choose not to cover behavioral health at all. That world didn't require much imagination if you lived in Oregon 20 years ago and needed mental health services for yourself, a family member, a friend, or, well, anyone. Well, Angela Kimball has an imagination. She can envision a state in which the Oregon Health Plan was true to its name, covering health needs above the neck. She saw a state in which health insurers covered all health needs equally without discrimination in amount, scope, or duration. With skills that included rock-solid knowledge of mental health issues and the legislative process, she communicated the facts with clear and concise confidence and made policymakers feel the impact that these injustices had on human lives. Her leadership got results. Angela has gone on, of course, to apply her passion and talent for the benefit of people around the country, and we are all the better for it. While the struggle continues and lives are on the line, we stay united when we remember the victories we have won, the lives those victories have transformed, and the advocates who have been with us all the way. And so congratulations, Angela, for this highly deserved honor.
Hi, everyone. Hi, Angela. My name's Becky Child, and I'm a professor of social work at Utica College. And I have been a friend of Angela's for many, many years. We got our start working together in advocacy. She worked primarily in the kids system. I worked in the adult system, but I found her to be an incredible friend and supportive of the work that I was doing in the adult system. I remember one of the people that I started working with her about and was so upset because of her situation. And I remember talking to Angela, and she helped calm me down so that other people could hear what I had to say, because I was so upset with what they had done to this person. And she's helped me with my advocacy at Oregon State Hospital, helping me write letters in ways that people can hear what I have to say and not turn it off just because I'm pissed off. And Angela and I have always had the ultimate goal of designing a better mental health system, one that can support families and people in their time of need. And Angela, unfortunately, lost her son, and the mental health system was not able to provide meet his needs when he needed it. I know that Alex is proud of you, Angela, and the work that you do. And I just want to say how honored I am to be your friend and to have shared this journey with you. I really missed you being here in Oregon, but I'm so glad you're in Washington, D.C. doing the work that you're doing. And I wish you continued success, and I hope that we can work together again in the future. And I will see you soon in the future. Bye-bye.
Thank you, everyone. I'm Angela Kimball. I'm the Senior Vice President of Advocacy and Policy at Inseparable, which is a new nonprofit that is dedicated to improving access to mental health care for everyone in this country. And I want to thank the Law and Mental Health Conference so much for this award. It's particularly meaningful to me because of the people associated with this who really started me on this journey many, many years ago in terms of being a mental health advocate. Bill Bushka, Becky Child, Bob Jundeff, Jason Renaud, everybody, and so many others throughout Oregon and around the country have really inspired me on this journey. And it really has been a lengthy journey about trying to improve how our country delivers mental health care, and really fundamentally thinking about the fact that we still discriminate against people with mental health conditions, and we marginalize people, and there are really horrific conditions under which people live. And this is something that we all need to be devoting time and energy to. I was telling Jason earlier, though, that I am really enthused and hopeful because I feel like the country is now starting to recognize mental health as something that's important for everybody. It is no longer spoken about as something that happens to other people, but not them. And I think that is a really key inroad that has been made because once you other people, you excuse doing terrible things to them. Now that mental health, particularly with the pandemic, has been brought home to the lives of so many people, and they recognize that in themselves, in their kids, we have a new opening to actually really change how this country treats people who have mental health conditions. And what I'm particularly proud of the work of the Law and Mental Health Conference for is really tackling some of the thorniest issues. And that is people who are in crisis and how we respond to those who have symptoms that are often very troubling to other people. And to me, some of the most heartbreaking stories are those that live in my heart about people who've been harmed in encounters with law enforcement because they were in crisis, or sometimes simply because they were living and just getting in the way in other people's perceptions. I think there's enormous energy around changing that dynamic and providing alternatives that are really at their core about providing respect and dignity for everybody who lives with a mental health condition. And fundamentally, that's something that we all want in this world, respect and dignity. And that really needs to shape how we look at every single law, how we look at the data we collect, and what we fund. So I'll pause there and just say it's been a fascinating journey. I have learned from so many people along the way. There's so much further to go, but I am honestly very hopeful about where we're all headed, and we're in it together.